Our rural communities are attempting to survive, and one of the ways that they need to survive is to make sure they have a quality health sector.
If we don't start using our local health care, we will lose it.
It's almost like we have a tendency to take things for granted. But the way health care is today, we can't take anything for granted any longer.
We have to start thinking about our healthcare providers and the healthcare community as part of the economic fabric of what goes on in rural America.
Nowhere is the crisis in healthcare more evident than in rural America. Hospital closures, failure to recruit and retain health professionals, and the outmigration of patients to large urban centers are threatening already fragile health systems and accelerating the pace of economic decline. But a growing number of rural communities are discovering that a key to their economic survival is creating a local healthcare system that serves their needs.
If you can't find something to do around here, you're just not looking very hard. There's always plenty to do. My father farmed, and his dad farmed, and I've got a son coming on, so hopefully we can keep it in the family. It was tough times for agriculture in the middle 80s, and a lot of people went out in this area. It's sad, you know, when it comes to the point that people can't make a living doing what they want to do. Sometimes it seems like it works that way. I almost lost my right arm at my elbow. I was electrocuted with a grinder. Dad got me loose from it, and then we went over there, and you know, it was bleeding real bad. They said you'd have never made it past the north end of Outmigration if you'd have had to gone on like to Tulsa or something. So I tried, you know, I keep that in my mind, and I don't criticize them at all, because I realized that they helped me one time.
Outmigration County is in east central Oklahoma. The population is approximately 36,000. The area is primarily rural, and agriculture is a large part of the economy, along with some oil and natural gas. And then the other is small and medium-sized industry. Like probably all of rural America, we're facing many different types of economic challenges in the creation of jobs, and good jobs that generate wealth not only for the local citizens, but the county and as well as the state of Oklahoma. Healthcare is one of the most critical aspects that we have, and we need to improve the healthcare services across the board because it's critical to improving the economic wealth of the area.
In Outmigration County, local residents and healthcare providers formed a community health coalition and began a strategic planning process to improve their health care and their economy.
The simultaneous crushing of Medicare, Medicaid, private health insurance through HMOs, and the loss of business to bigger cities for health care has put a lot of pressure on our local institutions, and at this point, this is the time to face that. It's up to us at the local level to organize our own healthcare system, build it from the ground up the way that we want it. It is a responsibility that we all have to face. Not planning it is just going to lead to a lot of chaos and economic loss.
Everybody finally woke up and said, we don't have adequate health care in this county. Now, what are we going to do about it? Well, each of us independently could do nothing. But together we could do so many things that it was incredible. By the time we'd gotten together once or twice, we all got excited. There are a number of health issues. People here took it very seriously. They were very honest, and they really told us. They told us a lot, some of which we probably didn't want to hear, but which we needed to hear. And you know, then we were all able to sit down together and say, gee, we've got a problem in this area, and we need to fix it.
As part of the planning process, the Oklahoma Cooperative Extension Service measured the economic impact of the health sector on Okmulgee County.
I've done a lot of studies relative to what's the impact of the health sector on the economy. And one of the things we do there is to quantify for that community the number of jobs created by that sector. This includes the hospital, the clinics, the pharmacists, the dentist, every component of the health sector. And when you add those up to various communities, the health sector is an extremely large employer, number one. Number two, the money is coming in from Medicare, Medicaid, which is outside dollars, and being used to pay for those services. So this is a strong plus for where that getting outside dollars to come in. The other key on the other side is to make sure that the people that live in that community utilize those services so that the money does come in.
In this county, the biggest employer employs 250 people. The medical sector employs nearly 1,000 people. We find in the healthcare sector, using the most conservative data that we can, that for every dollar paid to a medical care worker, it multiplies 1.4 to 1.87, depending on how you look at it. So in Okmulgee County, for instance, our total payroll is $24 million for all of our healthcare providers, but it generates $44 million in economic activity. So that for this county is a tremendous amount of money.
Henrietta has a population of about 6,500 people, but actually the trade area where people live, you have about 14 or 15,000. The hospital is the third or fourth largest employer in this area, and it would be devastating from an economic standpoint if the hospital was to close, not the fact that there wouldn't be close medical care. So it's a two-edged sword there. It really serves both purposes.
The thing that a lot of people don't realize that the healthcare industry is just like a manufacturing industry that brings 15 people to town and makes widgets, and we'll go out and give away the ship almost, or give away the taxes for 5 years to get somebody to come in that employs 5 people, but we oftentimes don't do that for service-oriented industries that make the same kind of contribution.
If our biggest factory was under the kind of pressure in the future that our healthcare industry is, there'd be an uprising to try to save the factory. And part of our responsibility is to get everybody clear that this is in fact an industry that is probably the biggest industry they've got, and one of the major employers, and a very high salaried kind of an employer that the community would like to hold.
The retirement industry is a big industry, and it's one that's going to continue to generate significant wealth for this part of Oklahoma. People are going to live a lot longer, and they know that there can be a good quality of life, and that good quality of life depends upon how well you feel. And how well you feel depends upon the kind of health care and the healthcare services that are available. And people know that. They are in a position to demand that. And so we need to be very responsive to that.
I think it's important that the community begin to understand the issue about buying local. In this county, we have 2 active hospitals and one that's a rehab hospital, but almost 50% of our patient days go up to the big city. Some of it's for very complicated neurological testing, et cetera, that we would not have, but most of it is a matter of us just losing the dollars to another city, and it's a big economic drain.
We want everyone to shop in Henrietta. We want them to buy their food in Henrietta. We want them to buy their clothes in Henrietta. We want them to buy their gas and oil, and we want them to buy their medical service in Henrietta. And when they take those purchasing powers out of Henrietta, we lose that income. In today's world, we have to understand economics better to stay alive in the economy, and we have to understand that sometimes we can cut our nose off to spite our face.
I could say with an absolute clear conscience to any business trying to locate here that there's very little we can't do here because of the coalition. I believe it's improved everybody who's participated in it. It's made us more professional. And I think in turn, our professionalism will rub off in the ability to provide health care, good quality health care, to more of the people in our county.
We're real excited about what's starting to happen now. For the people to take control of their own health care system is a big leap, and it's not an easy process. But the consumers know a lot about what a healthcare industry ought to look like for them and what would entice them to utilize it and refer their friends. So it's up to them to tell us what it is that they need their healthcare system to look like.
In the East Kentucky coalfields, citizens are also looking to their healthcare system as a tool for revitalizing some of America's hardest hit rural economies.
We've got about 9 churches and not a jailhouse in town. So that should answer it. Whatever you need, we got medical care here, and of course that is a good aspect of a community where you can have easy access to medical care. You never know when an emergency is going to hit, and of course a lot of people doesn't use our clinics here, but I think it is a good thing to have here. Before I retired, me and my wife talked about moving away from here, and then the closer it got, we said, well, what in the world are we talking about? Been here all our life and then going to pull up stakes and go somewhere else, make new friends, and we just squelched that idea right away. You have a togetherness among your older people here, and that's all races. If you've been here quite a while, then you know everybody, and it's just a togetherness. That's what it is. One thing that hurts our community, our young people have to leave here because the opportunities are limited. They're just not that many opportunities here for them.
Harlan County is a place that has a lot of historical background as being very isolated, the mining industry. As it is right now, we're looking at a population in Harlan of about 36,000, and that population has declined over the last 10 years. About 33% of our county falls in the poverty rate.
For years, we've been a one-industry county, and that being the coal industry. Through technology and so forth, the coal industry uses fewer and fewer people and still produces as much coal as it always has. So our challenge now is to provide a different source of employment for our people. Healthcare has always been an economic tool for the community. There are 2 ways to look at it. One is the quality of life issue. And secondly, what a lot of people don't realize is that the medical community generates a lot of income into the community. It provides a lot of good jobs. Those dollars turn over in our community several times, which helps the other local businesses and so forth. That in itself is a very important aspect of what the medical community can do from an economic standpoint.
Healthcare is the 4th major employer in our community. So you can see that will have a major impact on it economically. Many times you will find that areas do not really realize the value of having a healthcare facility here. They think, well, it's always good to come in for emergency care, but go some other place. But many small rural hospitals are closing because of, they cannot remain open financially. So as our community is looking at that, it behooves all of us to think, what can we do to help our community hospitals stay open? And our community hospitals looking at saying, what are the health needs our community have? What are the services they need?
In Harlan County, many residents were dissatisfied with local health care services. Health care providers, in turn, were concerned with the financial outlook for their operations. Together, they began a planning process called community-initiated decision-making.
What we're trying to do here is reinvent local health care so people will utilize it. Healthcare traditionally has been managed from a top down. They look at lots of numbers from far away and lots of trends and say, okay, this particular facility needs this, this, and this. And then they wonder why it's not used. Well, maybe because they didn't ask the people that live there what they want. So that's what this process is all about. We are having the first of a series of community-wide meetings. So we're trying to invite the public in, everybody, to come in and have their say on what their concerns are in healthcare and what their top priorities are. If they could change anything or add anything, what would it be in healthcare? And so tonight we're going through that process, and at the end of the meeting, everyone will get a chance to vote on what their top 5 needs are. And then we take that back to the council and start the process of coming up with alternatives and solutions and how we implement it. The system is any facet of healthcare, school programs in health, preventative educational programs, the whole gamut. So don't limit yourself just to physician or pharmacist or something.
Ambulance services, I think they've got, what, 3 ambulances over here? If there's 3 ambulances run, people out on an ambulance run, then there's no ambulance.
When they're all running.
So there needs to be more of them.
More ambulances.
And they need to be spread out. Like you're an hour from the hospital.
More services. Better located throughout county. That is a real issue, yeah. And it could be life or death, like you said.
One choice was to stabilize or lower health care costs. Number 2 was the 911 service. Number 3 was better education for teen mothers, parenting. Number 4 was outpatient clinics through the hospital. And then we had a tie for 5th. Number 5A is all.
I think it's been a very positive experience. The people feel good that the hospital and people that are working with them have come out and asked them their opinions and have looked at what is the community's perception and where are the problems when they go to the hospital, what are the problems they have to deal with as a patient or going to the emergency room, these types of things. And I think they have begun to see that the hospital is taking it seriously. They're not going to change overnight, but changes have been put into place. They're trying to respond to these needs.
The community decision-making process has brought together the community's perception of healthcare as well as the hospital perception of it. And we're working together to see how can we blend the two. Because a lot of times what we feel as a hospital that we're providing and what the community feels we're providing are 2 different things.
The whole concept of economic development and healthcare being hand in hand is really a relatively new one, and really a good part of the community-initiated decision-making process is to educate the community of what it is healthcare can mean to a local economy in terms of hard dollars.
There's always the perception that the grass is greener on the other hill. The same thing is true with the medical community. People feel like they can go down the road to the next community or go on to Lexington or to Louisville and get much better medical service than they can here, which is not necessarily true. 90% of the things that they have done in those other communities can be done right here with as good or if not better staff.
Harlan County spent $120 million last year in healthcare. That's a lot of money. Okay, 50% of that out-migrated. We've got to educate people that we need to take care of our own. Now that doesn't mean that we need to have a substandard level of healthcare. Absolutely not. That's part of the reason why we're doing this project, is that the healthcare providers in this area are realizing that their future is their community. Therefore, they have got to become very responsive. There's an education happening on both sides. So there's a tremendous advantage to supporting and building a local healthcare system that we support and utilize. I mean, there's money here. There's jobs that can be made here, you know, without smokestack chasing, basically, you know, where you have to go out and give away so many incentives. The base is here, so it can be a win-win situation.
I think it would have a tremendous economic impact or downturn in our area if we did not have the facilities that we have. So it really is a community business that we have to make sure that we keep available. And that's the type of information we got to get out to the community. Otherwise, we'll wake up one morning and the hospital will be closing the doors.
We all need each other, and I think that's something that we're all beginning to realize. In order to stay in this community, we all have to work together. Collaborations, that's the key.